At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Pain and Pain Management on Wednesday, April 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. Dr. Tom Roselle here with a little bit of a scratchy throat, but I think that's the springtime weather that we've been having. First year it's ever bothered me, and I'm not sure why, but I think it's because I've been running like a crazy man, and getting ready to go here and there and travel and do all these things that, most sane people wouldn't think of doing, but I've never been accused of that, so I guess that's all right. But we've got a program too that's, as we've said, leading into an in-house program at the Roselle Center for Healing on April the 16th at 6 p.m. And we're going to be doing pain and pain management. And I think you're going to find this fascinating. There's so many people, as we've mentioned, that are in constant state of pain, and they put up with it by taking drugs. They put up with it by doing all kinds of weird stuff, and they don't see a way around the process. But we're going to cover it on a multidimensional basis. Dr. Stephanie Pina and I will be co-presenting, and we're going to talk about the biochemical pathways. We're going to talk about the energetic pathways, and we're going to talk about what happens when you have a central pain pattern that's involving in the nervous system. There's a term that's used, wind up pain, and that means that it continues to self-perpetuate itself regardless of what you do. And then when you try to put medication in it, it actually increases the sensitivity when the medication's not there. So we're going to get into that. But more importantly, on the 16th, I'm going to show you what you can do about it and how to stop this vicious, ugly, nasty cycle that continues, that puts you in this chronic pain pattern. So that's what we're going to talk about today. We're going to talk about chronic pain syndrome and what that really is, and why in many cases you failed to be able to do anything. You go into the doc, they're good guys, but all they do is they're going to load you up with medications, anti-inflammatories. They're going to give you things that suppress the nervous system, particularly your mental pathways, so you don't sense the pain, if you will. You don't record it the way. And their idea is that it'll break the cycle. But the problem is it really doesn't. And when some people, in the initial stages, that they can blunt that loop, that chronic wind-up pain, then they get some relief. But the underlying why is that is still not understood. So let's get into talking about chronic pain syndrome. And when we're done today, you're going to go right into the live stream. And we're going to continue the discussion, and we're going to get a little bit more in depth with some of these things. But here's the deal, that almost 23 to 24% of adults in this country experience chronic pain. And what does that mean? That means pain that's there at one level or the other all the time, just never goes away. And there's a lot of resources that are available to kind of suggest, if you will, why it's there. And if you're a reader like me, I'm going to go in and I'm going to do the research, and I'm going to dig deeply, and I'm going to audit, pain management, chronic pain, central pain patterns, wind-up pain, things of that nature, and we're going to see what it says. But a chronic pain syndrome is a condition where pain persists ongoing after an injury or an illness, or for some strange reason, just shows up for what apparently is no reason at all. And, when you look at a chronic pain pattern, they're kind of modifying it after a fibromyalgia type of situation, which means that the pain has to be persistent for more than 3 months. Now, the difference in a chronic pain pattern and fibromyalgia is this. Fibromyalgia means that the pain is in all four quadrants. That means it's your arms, your legs, and so forth, and it's there, and it persists for 3 months. And there's a lot of differentiating circumstances. So I'm just giving you one of them, and we're going to get into both of those on the 16th when you come into the office, and we're going to really talk about it. But here, with a chronic pain pattern, it can be anywhere. And guess it could be a life-altering thing because it's just stopping you from doing anything. Same thing as a fibromyalgia. The symptoms of this kind of condition include, deep pain. It could be sharp pain that's always there. It could be pain that is dull and unrelenting. It just, this constant vice-like just doesn't go away. There can be accompanying fatigue. Obviously, there's going to be fatigue if you're in pain all the time. Your body just can't handle it anymore. And the emotional distress that goes along with it, just the give up type of feeling, the depression that's there. Those are all part of the symptom processes, but it's not necessarily the pain that's being triggered by the emotional distress, albeit it can. It's not just the pain that is being triggered by the fatigue pattern, albeit that you can be more susceptible to things that are going to happen because of that. But the pain itself has other triggering mechanisms. And it can be, as we've talked about, injury patterns that have taken place, even going back to when you were a child, because the nervous system does not forget the pain pattern unless it's fully resolved and it's detached from the central nervous system. There's a concept that we talk about in my world in functional medicine, and it's called injury recall. And that means that if you had an injury that's never been fully resolved, the body can recall that injury and the pain that's associated with it in an ongoing manner until it's completely unhooked, if you will, from the nervous system. And that injury recall pattern is really vicious because sometimes it can be triggered by an emotional situation. What do I mean by that? I just said that, the emotion can trigger it, but here's the psychological piece that's associated with it. Let's say that you got into a fight or somebody hit you and there was words that were said and there was a high emotional presence at the time for whatever reason it was. It could be with even a spouse. It could have been with somebody that you cared about when you were young. It could have been that you were pushed into something when you were a young person. And anytime that emotional state presents itself, it's like a button that brings up all that other stuff, all those psychological pieces that your nervous system remembers as part of the distress, if you will, that caused that injury, that pain to be present. It's a real situation. It's just like pushing a button. And so subsequently, you have to take that into consideration, and you'll notice that people will use certain terminology. Their presence will be very different, if you will, than what they could be in or were, years ago before this took place. So when we look at those previous injuries, so even an infection, if you will, infections, if you get in a tooth infection, an infection, if it gets into the brainstem, and we're just talking about bacteria, we're talking about infections like viral patterns and fungal patterns and so forth. Women often will get what we call vaginal fungal infections. They're called yeast infections, candidiasis, if you will. And if it's fulminating, it can cause the ovaries to be irritated, the uterus to be very tender, and so forth. It's deeply embedded. If that embedded situation continues without being disconnected, even though that's been treated, even though the antifungals were taken, even though the diet was changed, even all those stuff. But if the memory, if you will, of that injury and the things that were associated with it were not there, this thing wouldn't happen. But if it's taken away, or if it's still there, if it's present, then what happens, it continues to trigger and come back and trigger and come back and trigger and come back. And now you have back pain, you have vaginal pain, you have a fear of intimacy and so forth. So those are the things. That's how that psychological pathway begins to bring up higher and higher and higher. What happens if you bump your head when you were young, right? And let's say that bump in the head was somebody popped you in the head, but the emotional pattern behind it was very in your face, very directed. Guess what you're going to remember? You're going to remember the emotional piece, and the emotional piece now becomes a trigger for that injury to come back. So you have to disconnect both of them. You can treat the pain, but unless the emotional piece is identified, and then there's ways of what we call scrambling it so it no longer has the effect on you. Unless that's done, it continues to come back and bite you badly over and over and over again. So, what I'm saying to you is that this pain pattern, this chronic pain syndrome, if you will, um, and there's a lot of different things that that they can finger point. Like burning pain and dull pain and throbbing pain. Believe it or not, they'll use that as an all-inclusive instead of just saying, I have pain in my low back that just never goes away. And, the interesting thing is lower back pain is the most common of any kind of pain patterns and accounts for something like 27 to 30% of all pain-related health issues. And here's the other piece of the puzzle. Did you know that up to 75 to 80% of all people at some time of their life will have back pain? Fortunately, a lot of it is quickly resolved. A lot of it that is very difficult. They see people like me and we can get rid of it very rapidly and find the other connections. But that's a huge number of people considering the population. Then the other piece is severe headaches and neck pain. We're talking about that kind of pain as well. Frontal head pain, back head pain, neck and shoulders just aching all the time. Severe head, neck, and shoulder pain accounts for somewhere between, depends on the author that you read, 15 to 18% of all chronic pain types. It's always there. Many of you know my story that I got into the world that I'm in chiropractic and acupuncture and natural healing because my wife had migraines from the time that she was 5 years old. Since she was 5 years old, they got progressively worse over a period of time. And when she was 24 years old, the fix was that they were going to fuse her neck from the second bone in her neck, the upper cervical vertebrae, what we call axis, and all the way down to the seventh, because her curve, her natural curvature, the C curve in her neck was reversed and it was putting pressure on the cord. And they figured that the only way that they could resolve the problem is that they have to fuse it so she would have no motion in her neck, and that might take care of the headaches. Well, we said, I don't think so. And I was in school at the time, so we started her in a chiropractic clinic in Elgin, Illinois. And the short answer was that after 30 days, all of her pain was gone. She stayed under care for quite some time to correct that abnormal curvature and get it back into position. But that's our story, and that's why I do what I do today. So understand that there's always an underlying reason. In her case, it was a reverse curve, but the fix was not something that was going to be solved by surgery. Actually, it created much more of a difficult situation and problematic pattern over a period of years if we had done that. Fortunately, our creator said, no, you're going to do this, and good enough. And many that know the whole story and that knew that I was headed off to medical school. And I thank good Lord every day of my life that I was able to get into the world of chiropractic and acupuncture and functional medicine and the things that we do, because it has saved thousands and thousands of people from chronic suffering, but also the fact that it's also saved lives, and which is an amazing, beautiful thing. But remember, we're talking about chronic pain syndrome, and that pain pattern has to be understood if you're going to fix anything. Otherwise, you're stuck with taking heavier and heavier medications, going to psychological biofeedback, doing all those things that rarely resolve the problem 100%. They modify it. They do a little bit to allow you to live with it, but you're still taking the meds. You're living with the Advil and the other NSAIDs, and then the drugs get heavier, and then they go to things like oxycodone. Today they give oxycodone like it's candy. You go into the hospital and they're going to offer you morphine, they're going to offer you oxycodone, and these are heavy duty drugs. They're addictive patterns. And so when you are given something like that and your doc says, let's see how this works. Oh, it works great. Well, go ahead and take it as you can. Oxycodone is a drug that is addictive. And you start, we have more and more of this garbage in this country today. Instead of trying to find the problem, we were talking the other night, and here's something that I want to share with you because it's really important. When I first went into practice, and I've been in this field for over 4 decades, and I've seen virtually everything that you can possibly see, and then some, people who are suffering with cancer and have tremendous amount of pain because of that, people who have space occupying tumors or just blows and traumas. I've had the pleasure of, very involved in the NFL and the I was the doc, as you know, for the Washington Wizards for several years, and I see all kinds of traumatic patterns. But these athletes are so tough; they keep on going, they keep on going, and for the most part, they respond rapidly because their bodies are in pretty good shape. But they still live because they were getting paid to put up with it with chronic pain. So we roll the clock back 40 years. We roll the clock back even 30 years. And miracles happen. People came into the office and, we were able to resolve things very, very quickly. So I'm talking to these group of doctors, friends of mine, and, we were talking, hey, do you still see miracles? And they say, not like we used to. And we looked at ourselves and said, are we getting bad at what we do? But the answer was that there's so much pollution in our environment. We are weaker as human species. We are overweight. We eat garbage. And so our body's highly inflamed. We don't get out and exercise. We don't even walk. And you've heard me say hundreds of times that if you walk 2 miles every day, it doesn't make any difference how fast it is, you reduce your risk of dying of a disease process by 50%. And then if you learn to breathe, you learn to stretch just a little bit, you use the walls at your house, to push against and kind of stretch out. You don't have to get down on the floor. You just have to do something, but then get away from the remote and get outside. But the food is the other piece. The foods that we eat are highly inflammatory unless you're taking the opportunity to buy good stuff. And what do I mean by good stuff? I'm talking about organically grown but non-GMO products. Okay, so we don't want it altered genetically, and we want to grow it the right way. Years ago, that's all we did. We ate well because the food was a much better quality than what it is today. We didn't grab, the pain medication at a drop of a hat. We were told to try to modify and change. My father came from the old country. I'm first generation Sicilian. And he wasn't well, and he went to the doc down the street who was from his village, and he was a cardiologist, and my dad was having a few problems. And what the guy told him? He says, Russell, he said, eat like you ate when you were a kid back in our country. And what he was telling him is that the food quality, even then, we're going back a lot of years ago, was not what it was overseas. And, so the problem is that we don't take the time to take care of ourselves and to be our own guardians, if you will, and our own police when it comes to the things and holding people responsible for making sure that we're producing quality foods. Have you been listening to the advertising on the radio and television by Bayer, right? We think Bayer aspirin, but they're a huge conglomerate and produce all kinds of things. They're trying to tell you that glycophates are necessary for growing crops in abundance. Otherwise, your grocery bills are going to go up. So what's glyphosate? It's Roundup. That's what they're talking about. They're talking about a weed killer. But that weed killer is causing all kinds of problems in our health. It can cause potentially cancers. It can cause neurodegeneration. It can cause autoimmune conditions. The information's there. But they're trying to get you to call your congressmen and senators to vote for a bill that says glyphosates are okay. No, I'm telling you, don't do it. I don't eat foods that are not organic or at least non-GMO and at least locally grown. Why? Because I know what's in them. And I would encourage you to do that, because if you got pain and you're eating those things, you're making your chronic pain, your symptoms much worse, because they're tied into an inflammatory loop. It continues that wind up situation that we talked about to begin with, and the problem becomes progressively more insidious. So I would encourage you that start modifying, start drinking water that's filtered. Don't drink it out of a plastic container. Why? Because that plastic will get in your system, and then that causes an inflammatory irritation and causes toxicity and causes things to be blocked. You know, your number one filter, believe it or not, is your skin surface. Number one, because it's the biggest one, but the one that does the most work, the workhouse, is your liver. Now, your liver has several phases of detoxification, but we'll talk about the first two. And you eat something, particularly a product that, like caffeine, if you will. No, even we're talking about coffee. But if that liver doesn't have certain adequate amounts of things like glutathione, if it doesn't have adequate amounts of B complex, then it's not going to work to break it down. So now you start backing things up and you're inflamed. If phase two, which handles most of the drugs in your body, is not working, it doesn't have levels of glutathione, doesn't have glycine, doesn't have B1, and the list goes on, it's going to also be problematic in being able to clear and break down those medications. So there's ways of checking that. And we do that very rapidly in the office to see if that's it. And then we can, go towards supporting the pathways. We can go towards giving you the nutrients. We can go towards dumbing down that wind up pattern by modulating the energetic system, by allowing things to normalize. And guess what happens? Then the pain goes away. So don't forget the 16th, right? Coming up pretty quickly, a couple weeks. I want you to join us at the Roselle Center for Healing in Fairfax. Call in the office. Go to 703-698-7117, 703-698-7117, or go online at drtomroselle.com or rosellecare.com. Register for the class so we can be prepared to serve you. And I promise you, I'm going to show you things that you can do. I'm going to show you how things are tested. I'm going to show you some of the modalities that we can do to help you and protect yourself. We're going to make a difference in your life. It's important that you have the tools, but more importantly, that you understand the why behind it. How many of you gone to your physician and say, why am I hurting like this? Why won't it go away? And they look at you and they say, well, let's see if this works. And they really can't give you an answer because they don't understand how that nervous system remembers the pain, how that nervous system winds it up and causes things exponentially to be worse than what they should be and what they could be if they addressed it the right way. So on the 16th, we're going to do that. We're going to really get together. And those of you who have been in chronic pain for a long period of time, that you've tried virtually everything, and you really come up with, now what do I do? Well, here's the deal. There's a lot that you can do, and we want to make sure that we get it done for you and give you the opportunity, one, to understand it, to really learn, two, to give you some options to deal with it and live the rest of your life in a state of health that you deserve. That's the way the body was designed to be. But because of how we've been trained, how we ignore things, because we're an expedient society, we set things aside because, it's too much effort. If it's not a click of a button anymore, we can't get it done. We're coming up to the end of the program. I want you to meet me right now into the live stream. Just go into drtomroselle.com. You should be able to find it that way. If you're following me on social media sites, you'll be told immediately that we're ready to go, and we'll continue this program. Remember, we're here every Sunday for one reason only. You deserve the data, but more importantly, I love you all. Have a great Sunday. We'll see you soon. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Pain and Pain Management on Wednesday, April 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.